Great. Hello, hello. Welcome, everyone. It's Dr. Shayla Toombs-Withers and Dr. Amanda Adkins. We are here with you live today. We hope that you caught our last live about 2 Tuesdays ago, where we discussed some relevant topics related to diabetes. It's National Minority Health Month, and so we're just happy to share these tips with you. I'm Dr. Shayla Toombs-Withers, based in Tennessee. And I'm the physician owner of Essence of Health Wellness Clinic and Coaching. And then I'll let Dr. Amanda chat.
So I am Dr. Amanda Adkins. I am in the Bay Area of California, and I am the owner and CEO of Enlightenment Health and Wealth, where we help women who are overweight get off those medications for blood pressure and diabetes so they can actually live out their God-given purpose in life. So I'm excited to be here, talk with Dr. Toombs-Withers today, once again, about diabetes.
Yeah, same here. Both Dr. Amanda and I are, both come from a perspective of a lifestyle medicine type of way that we practice. And so, we both share a passion when it comes to talking about diabetes and helping people to prevent and even reverse many of these common chronic diseases that affect our population nationally, but also greatly affect minorities within the country. And so, yeah, we're certainly happy to be here and share these things with you all. And so today, we were going to start with some of the complications of diabetes, because last time we talked a lot about nutrition, but we just wanted to dive in a little bit more regarding some of the possible complications of diabetes when your blood sugars aren't very well controlled. So, Dr. Amanda, what are some of the things that you like to highlight regarding that?
So I like to highlight the diabetes that can actually occur in your eyes called retinopathy. So most of the time, you may not even notice that your vision is changing, but it is highly recommended that as soon as you're diagnosed with diabetes, that you have a diabetic retinal eye exam. It doesn't matter if you think you've only had it for a day or 10 years. You definitely want to have it as soon as your doctor says, yes, you are a diabetic. You want to try to get it as soon as possible because you have small vessels in your eyes, and diabetes definitely can affect your vision and actually cause blindness. So we want you to get that checked immediately, and then also at least once a year. That is one of the biggest ones that I say usually when I first talk to people about diabetes is their eyesight. I'll let you take the next one.
Yeah, yeah. And then the other thing about eyesight, I always have people say, well, I can see just fine. I don't wear glasses, but that is not the sole reason why we are sending you to the eye doctor. Like Dr. Amanda said, there is a condition called retinopathy related to diabetes. And it's something that you can't see. We definitely can't see it with the naked eye. And so that's why it's so important for you to actually go to the eye doctor and get the retinal exam so that they can see deeper. And it may be one of those things you might feel like you can see just fine right now, but that doesn't necessarily mean that you haven't started to even develop some of those retinal changes within your eye.
Yes. So
Yeah.
looking at that, the next thing is kidneys, and actually talk with a nephrologist about this because a lot of people, when they hear diabetes, they also think of dialysis. So people go to the extreme with kidney function. And you may develop what we call chronic kidney disease. And I can definitely say that a lot of my patients that have diabetes and have diabetes for a while, they actually may be at like different stages of chronic kidney disease. So time you get to dialysis is more end stage where your kidneys are failing to work, failing to filter, which is what your kidneys are supposed to do. But you can have other stages of kidney disease that may not affect you to be where you're actually on dialysis, but definitely will cause us to make some changes like in your medications. You have to make other diet changes, things like that when you have chronic kidney disease. So stage 1 is normal. You can go to stage 2, which is a little bit underactive. Stage 3 is where I usually find most diabetics that either been uncontrolled for a while or didn't know that they had it. And then you go to stage 4, between, like, there's two stages actually of stage 3A and 3B. And time you get to stage 3B, you definitely need to be seeing a kidney specialist, because there's a lot more things that they want to look at, like your bones and all that kind of stuff, or bone blood tests that they need to be careful of. You may become anemic because your kidney function is getting worse. So you definitely want to make sure that you always ask your doctor about your kidney function, and if you have any of those stages of chronic kidney disease, because like I said, even though you're not maybe at the dialysis stage, you definitely could have some damage to your kidneys and need to avoid certain medications if that's the case.
Right, right. And that also, just speaks to that importance where a lot of people tend to have this thought that, well, if I'm feeling okay, I don't necessarily need to go to the doctor routinely for my checkup. And that's just certainly not true, especially when you have a condition like diabetes.
Mm-hmm.
And, I'm going to piggyback and say that high blood pressure too
Yes.
can cause, many of these similar complications. And a lot of times the diabetes and the high blood pressure will go hand in hand, contributing to a lot of these conditions.
Mm-hmm.
And in a lot of instances, unless these things are like really, really severe, you may not be having symptoms necessarily. It's one of the reasons why we call high blood pressure the silent killer. But even, some of those earlier changes of diabetes, you may not have any symptoms either. But it also just speaks to that importance why you should still be going to see your doctor routinely. You should be having those routine checkups. You should definitely be having your labs monitored so that we can track these
Mm-hmm.
changes. Because like for kidney disease example, sometimes we may see it just a little bit off, but then if you don't come back for a year, and then there's this full change that we could have caught much sooner once we were seeing the trend that each time, slowly by slowly, it was showing a little bit more damage there. And then even the other thing with diabetes, if you're controlling your blood sugar, especially incorporating a plant-based type of way of eating into your diet, you can reverse some of these complications too. There have been some studies that have been showing some reversal of some of the kidney damage that's been done once people are improving their health and improving their blood sugar. So also speaks to the importance of nutritionally following more of a plant-based way of eating.
Yes, I love that you bring that up, because sometimes people start to become hopeless once they
Yeah.
figure out, or been told that they have these chronic conditions. And that's why Dr. Toombs-Withers and I love lifestyle medicine, because so many things that if you make these simple changes, I know it may not be easy all the time to do the recommendations that we ask, but these simple changes, and you can have so much change in your health for the better if you're able to implement these things. And like she said, you can reverse these things. They don't have to be once they're there. Or once your family member has been told that they have it, that you're ultimately going to get it also. That's not the case. We can definitely reverse some things and make these changes. So as you're listening to us, we forgot to do our little disclaimer. So I was like, I want to come back in and say that. So anything that we tell you on this video, please make sure you talk with your own healthcare professional, your medical physician, or your healthcare provider before making the
Right.
changes.
None of this
So get
constitutes
this.
medical advice for you.
Yes,
We are
yes.
not acting in the capacity of your doctor. Go see your own doctor.
Yes, yes. But we like to
Yeah.
educate you, so at least you can
Right.
have a conversation with your doctor. Because even as I meet people outside of the exam room, they're always like, when I go to my doctor, I don't know what questions to ask them. So that's why we
Hmm.
want to come out and educate you, so that you can actually have a conversation with your doctor and not just take what they say for face value. Of course, you want to trust your physician, but you also want to have a conversation so you understand your own health, and make sure you understand your own numbers. So, like I was going through with the kidney disease, like you can, sometimes we may be, hurried, unfortunately, and we may just say, oh, your kidney function is fine. But you may say, hey, doc, has it changed from before? Or what are my actual numbers? Do I have chronic kidney disease? Because a lot of people will say, oh, I saw in my chart that you said I had chronic kidney disease, but I never talked about that.
Yeah.
So you just may ask those questions, just to make sure you understand about your own health. So
Yeah, that is so true. I've seen patients and they'll, come in and they say, "Oh yeah, my last lab check, well they said everything was okay." But, for us as doctors, like, well, what does okay,
Okay, me.
actually mean?
Yes.
I need to see the numbers, because what
Hmm.
okay, for us is going to mean something different. They may have told you okay because in the grand scheme of it all, yeah, there was nothing strikingly wrong, but that doesn't necessarily mean that there weren't any early changes of something or something that needed to be monitored or tracked. So it is important for you to know those questions to ask and follow up so that it can
Yes.
be monitored.
Please
And
follow
so,
up.
yeah, for sure. And so, getting us back to, people, that big question people have on what can they eat. I know a lot of times for me, I'll meet people and they'll say, well, I stopped drinking soda. So now, my diabetes should be gone or my sugar should be improved. So what do you typically, Dr. Amanda, tell your patients when it comes to carbohydrates and diabetes?
So one, when they talk about the soda, I was like, oh, great job. You're on the right track. So let's talk about what else we can do to help with this.
Right.
So when someone asks, oh, or say, oh, I'm avoiding carbohydrates or I'm avoiding carbs, I decrease my carbs. I try to go deeper. Like, what do you mean by carbs? I mean, I think I know what they mean, but what I think when I say carbs and what they say when they say carbs, it could be two different things. So I always ask for clarification. Are you talking about, eat bread, rice, and pasta? Are you not eating chips? Like, what exactly do you mean? Because there's carbohydrates in most foods, and they can be healthy foods that you're trying to say that you're avoiding. And I want to make sure you're not avoiding just in general carbohydrates. You don't want to be eating those processed foods or processed carbohydrates, but you definitely still could be eating, because most people think they can't eat rice at all. You can still eat some brown rice, it may be just in a smaller portion. You can still have sweet potatoes, but it may be just in a smaller portion. Broccoli, cauliflower, carrots, all those things are carbohydrates, but they are so full of nutrients that I want to make sure that you're eating if you're a diabetic. You don't want to be avoiding these foods at all. And so that's why I was asked, what do you mean by carbohydrates? I don't want you eating chips. I don't want you eating, white rice and, a lot of white potatoes. But I definitely want you to be eating these other things. Or I don't want you to be eating a lot of sugary cereals either. You can
Mhm.
have oatmeal, things like that. But we just want to clarify carbohydrates. A patient actually earlier this week, yesterday, because today's only Tuesday. So she was like, oh, I've been a diabetic for a while and I've always been told not to eat a lot of carbs. And so I've been eating chicken. And so then we had to go into that whole conversation like we talked about last time. So you can check out our previous video where we talked about chicken and saturated fat. And
Mhm.
so she was so happy to hear, different perspective of nutrition than just cutting out carbs. So what do
Right,
you think?
right. Yeah, for sure. Because, a lot of people think of carbs only as like the soda and the dessert. So, a lot of people will say, yeah, I know I just need to, maybe stop eating so many cupcakes or stop drinking so many sodas. But like you mentioned, it goes even more beyond that. So you still, want to take that white bread off of your sandwich and
Yes.
those foods that you tend to cover in flour, or even things that you don't necessarily think about, like the gravy that's nothing but
Mhm.
flour. So those are carbs too that you're going to want to be mindful of. And it's not so much that you can't eat any carbs, because we want you to eat carbs are fuel, and we want you to think of food as fuel, but you do want to have more of those unprocessed things. So you want to think about things that actually look like a grain. Most of us know, what a grain should look like. So think about that, the dried oatmeal in the bin kind of thing. You want that's how you want your carbs to look. And then even those other, not so obvious carbs like carrots, like you mentioned, or uh green vegetables, or
Mhm.
peppers, putting peppers in your meal. Those are carbohydrates, and those are certainly fine for you to eat. I always, joke and tease people and say that there are no studies that too much kale is going to, worsen your diabetes. So, uh, you know,
Well, I
so go
love
for
that.
it. Yeah,
Yes,
eat
yeah.
those things and nourish your body. I've seen a lot of patients who have done these more keto type of things where they're almost afraid to even eat, even eat the healthy carbs. They're, cutting all the fruit out and cutting most of the vegetables out, and they're just eating these high saturated fat type of things. And then they wonder why, they don't feel so great, and their cholesterol is still up, and, and their blood sugars, even if they eat a grape, now their blood sugars are, skyrocketing. And so we don't want you to do that.
Right.
Yeah.
Yes.
We want you to have these healthy things.
So I know there's people that may be out there looking like, oh my gosh, you just kind of went a total left field with the carbohydrates.
Yeah.
So definitely, if you have questions about that, put it in the chat. We'll come back and look at that and answer those for you, because I know that's not conventional thinking, especially for diabetics. If you've been to like a diabetic dietitian or nutritionist, or went to diabetic classes, it may be something totally different than what you've learned. So again, we're here to educate you so you can actually learn the information. Another thing that they mentioned was alcohol. So, Dr. Toombs-Withers, what is your intake on alcohol with diabetes?
Yeah. And so alcohol is going to come with some carbohydrates, and it is going to, spike your sugar in a sense. But if you're going to consume alcohol, first off, you want to consume it in moderation and not, heavily drink, just because that's going to cause a whole gamut of issues beyond just diabetes. But if you're going to consume, 1 to 2 drinks a week kind of thing, that's fine. But be careful of the sugar intake. So if you're having mixed drinks, for example, those are going to be very high in sugar just from the process that they have to go through to create that daiquiri or margarita or whatever it is that you like in that fruity mixed drink. So you really want to steer clear from those, because those are going to tend to be high in syrups and things. And then even if you think about beer, well, beer is grain, that's how they make beer. And so that's going to tend to spike sugar for a lot of people. So, you definitely want to be careful when you're drinking your alcohol, and in any instance, you don't want to drink calories. And we know alcohol can tend to be high in calories, but not provide any sustenance in terms of filling you up, and it's not providing you any nutrients. So you definitely, want to moderate that.
Yes, that's exactly what I was going to point out. You don't want to drink your calories. So if you look at it like that, it's going to be like sugar, like going right in, which I always also like to tell people, like same with fruit juices. You're just drinking that sugar, and you will see the spike in your blood sugar numbers, being diabetic. And it just causes your body to produce more insulin, and it kind of works harder. Even if you're not a diabetic, your body just has to work harder to actually get that sugar out of your bloodstream. So I always caution people, like I tell them, if it's a holiday or special occasion and you're drinking alcohol, like I said, do it responsibly, and you just want to be careful. But I try to have people steer away from that on a daily basis, just because you're just drinking excess calories, especially because sometimes as diabetic, we're trying to lose weight. And you're just going to store it as more fat. And again, we talked about before how you're just going to store fat, and that's going to just cause your diabetes to be worse long term. So just be careful with that.
Right. Yeah. And then even to piggybacking off of the juices, because that's one I commonly hear from people too, say, well, I put down the sodas, but I'm drinking juice. Well, we eat the fruit, eat the apple instead of drinking the apple juice. When they juice, the process that it takes to get a juice for you, they've taken out a lot of those nutrients and that fiber and those good things from the actual fruit. And so you're just getting a concentrated version of that. And, like Dr. Amanda said, it's going to just spike you sky high, because it's like your body's getting this kind of shot of concentrated carbohydrate, versus if you had actually eaten that apple and gotten that fiber load, it would have been released much more slowly into your bloodstream, allowing your body to catch up and allowing you to be able to process it better. So always choose the whole fruit over the fruit juice, or even the smoothie for that matter. Now, I love my smoothies just as much as anybody else, but if you're, especially if you're suffering from diabetes, then you definitely want to go with more of the whole fruit than a smoothie or a juice.
Yes.
Yeah.
One other question I like I want to make sure we bring to the topic, because a lot of people have this. I actually had a patient today talking about this, is nerve damage from diabetes. and neuropathy. And so I know a lot of people think once you develop neuropathy, so people might start feeling a burning sensation in their feet, like numbness or tingling. And they think, oh, that's it. I'm going to have that pain forever, which sometimes we were taught that that could be the case. But like Dr. Shayla was saying earlier, there are some things once you change to a plant based eating style that these things actually have been shown to reverse. And initially they thought it was just the nerve, but there's some people that actually, when they changed their diet, that it actually opened up those smaller blood vessels where the nerves actually get their nutrients from. And then once those were healed, the neuropathy or the nerve pain went away. And that was like mind blowing to me, because I was having so many patients that had, long-term neuropathy, and it's just like more and more medications piled up on them. And it was like, I don't know what else to do. One man even tried to go for like a stem cell
Mm.
replacement with some new technology that was out to see if that would help. But learning again, lifestyle, things that you can
Yeah.
do that change that would not cost you more and not cause you more damage, would actually give you more relief without the side effects. I'm all for it and want to again educate so you can actually reverse the nerve damage also. So that is, I know, hope for a lot of people with hearing that message.
Yeah, yeah, for sure. A lot of people too, they equate diabetes to kind of thinking of a grandparent or an older
Mhm.
friend who may have had a toe cut off or a limb cut off from, that started as some of these neuropathy type of changes and then developed into these vascular issues. But yeah, so it's promising and good to know that by changing what we put on our plate, that we can, reverse these things and we can improve these conditions too that way. And then, another topic regarding fasting. We've heard, a lot within the diet world about intermittent fasting and, should you fast, should you not fast, and fasting being good and fasting being bad, and all these different things about fasting. But what do you typically tell your patients when it comes to fasting and diabetes?
Yes. So first we look at the medication and see what they're taking. But most time I tell people, yes, you definitely can fast. I tell people you want to give your body that time to actually rest and digest and be able to cleanse and be ready for the next meal. We don't need to be eating continuously. Now, we have to be cautious, like when you're on diabetes medications, especially like medicines that will bring your blood sugars down immediately, that will help you to produce more insulin, whether it's insulin or like sulfonylurea, like glipizide or glyburide, which if you don't eat and take that medication, then your blood sugar is going to drop too low. And we definitely are not advocating for that, right? So you definitely want to work very closely with your primary healthcare provider if you do plan on fasting, so that if they need to adjust your medications while you're going through that period, that it's actually more safe for you to do. But actually, fasting with eating plant based has been shown to help with diabetes and high blood pressure, since we talked about that earlier a bit more. So you just have to work very closely with your doctor about adjusting medications, because you'll likely need a decrease in your medications. And I'm definitely for that. When patients tell me, I just tell them to let me know when, and we talk about how to adjust their medications so we're not causing you problems. We don't want you to end up in the hospital or the ER, or
Right.
God forbid, a coma, because your blood sugars
Mhm.
drop too low with the fasting.
Right, right. Yeah, and then another disclaimer that we should have mentioned earlier. When we are talking right now, the things that we are talking about are recommendations for those folks who are not necessarily insulin dependent, so not necessarily our type 1 autoimmune type diabetes patients. We are talking more of, what was previously called type 2 diabetes, or adult onset or what have you. It's had a lot of different names, but that's the one we're talking about when it comes to these things, because we know our autoimmune type folks are lifelong dependent on insulin because they don't make insulin, so that's a whole different topic of discussion. But definitely consult with your doctor. Definitely, make sure that you're tracking your blood sugars closely. And talk to your doctor to make sure that you're doing it safely. One, to make sure fasting is going to be right for you, and two, that you're fasting safely. I've had some people come to me where they've, read about online some water fast or something. And there are places where water fasts do have their their place, and water fasts do help. But typically the part that people miss about water fasts is that people are closely under the care of a supervised health professional. The
And you're not
places
at
I know.
home.
Right, you're not at home. Exactly. You are in right up under the care of that health professional that is closely watching you, for people who are doing these straight up water fasts. And so, keep these things in mind. Don't just kind of go out on your own and say, okay, yeah, I'm gonna fast and do this on my own, and just take yourself off of medicines and do things, because we definitely don't want you to be sick. We definitely don't want you to pass out anywhere or need to be in the hospital. That's never the goal, for improving your health condition. So
All right.
yeah. And now, so if anyone has any questions even after this video, always feel free to put it in the comments. We both will, follow up and are happy to discuss further with you. I will share that I do have a masterclass event coming up on Sunday. It's called What Your Doctor Didn't Tell You About Reversing the Health Crisis Trifecta. And really, the health crisis trifecta is something I've coined, which includes high blood pressure, prediabetes, diabetes, and high cholesterol. So I'll be sharing some tips and tools of the trade to help you reverse those conditions and help you to improve your health, with eating real food, like we've talked about here, and making some practical, sustainable changes. So I will put the link for that and hope you can join me. And then, Dr. Amanda, what do you have coming up to share?
So I'm actually going to be starting a movement group. Actually, American College of Lifestyle Medicine, May is Movement Month. So I'm going to have people join that so we can make sure we are moving throughout the month of May. So if you're interested in that, definitely send me a message. I'm going to be sending that out to my group to start that. And then also, if you're interested in private health coaching, you can always reach me at dramandamd.com. You'll see it scroll across the bottom there, and reach out to me and we can get you scheduled for that. But I definitely encourage you guys to join Dr. Shayla's masterclass on Sunday. I'm sure it's going to be lots of more helpful tips and information. So like I said, we're both here to help you. We want to see everyone that are affected by these diseases, like she said, the diabetes, prediabetes, high blood pressure, high cholesterol, actually learn about lifestyle and how you can actually get off medications, and actually do that safely and actually carry that out through your family history and family future.
Yeah, for sure. Just exactly what you said. So, thank you all so much for joining us and for tuning in live today. Like we said, if you are watching the replay, just put that in the comments and leave us any comments or questions that you have. And we hope to be joining you again in the near future, Dr. Amanda and I. So, have a good rest of your week.
Bye bye, everybody.